Hi, good morning to everybody. Today we are here to discuss about Milieu therapy. Milieu therapy, it is a French word in English translation. Milieu means surroundings or environment. It is otherwise known as therapeutic community or else therapeutic environment. In this Milieu therapy, the sufferers, the patient who are suffering with the psychiatric endeavors, we are change the environment. By that we will be made the people to be healthier and comfort. So definition, in psychiatric health nurse, that is a structure provide and maintain a therapeutic environment in collaboration with client and other healthcare clinicians. It was given by American Nurse Association in the year of 2000. Next, a scientific structuring of environment in order to effective behavioral changes and improve the psychological health and functioning of the individual, which was given by Skinner in the year of 1979. The goals of Milieu therapy to manipulate the environment so that all the aspects of clients in the hospital experience was considered as a therapeutic, and they expected that learning to learn the adaptive coping, interactions and relationship skills in their life. Achieving a client autonomy to minimize the maladaptive behavior helps to improve the self-esteem of the patients. The characteristics which distributing the power of self and open up the communication skills of the patient, and structured intervention based on the changing the environment which promote a conducive to the patients. Work related activities which in a therapeutic interventions we will formulating. The community and family will involved in the treatment process and adapting to the environment to meet the developmental needs of the client in future. The principles of immunotherapy, it is to promote the fundamental respects of the individual, both client as well as staffs, and have an opportunity for a communication between the client and staff with the maximum therapeutic benefits, which heals the patients and promote the patients. To encourage the client to act at the level of equal of their ability and to enhance the self-esteem, that is autonomy to be reinforced to have a self-actualization and goodness. To promote the socialization, to provide the opportunity to the client to part of a unit of management as well as community. The key components of Milieu therapy. So here we are having the four key components. That one is containment, validation, structured interaction, open communication. So process of these four key components which the Milieu therapy is more effective. The interdisciplinary team who are directly involved in the treatment aspects, that is psychiatrist, clinical psychologist, psychiatric or else clinical nurse, psychiatric social worker, occupational therapist, recreational therapist, music therapist, art therapist, dietitian, clinicians. So these all the team members were actively participating in the Milieu therapy to have a good changes in psychiatric patients. The advantages of Milieu therapy, it is create a different types of attitude and behavior in the patients because of the environment. It's like our home. So we are making the patients to be comfort as they are in the home in the hospital settings. And here we are making a patient to be adaptive, to have a decision making skill which will become a less dependent and passive with the others. We have promote the patient through adaptive behavior which is useful and accepted by the therapeutic environment, and improves the self-confidence and develop the harmonious relationships between the members in the society, and develops a leadership skill to being alone and stand alone. And we have made the people to be social centric persons and learn to live and think collectively with the members who are present in the community. Here we are having a few disadvantages, that is role burning between staff and patients. Due to that, it is easy to become nobody's responsibilities to access about the patient care. The individual needs a concern, whether it may be met or not, that is going to be a huge query. And the transitions of community is difficult, and it is having a limited, that is the hospital patients only can experience about the milieu therapy apart from the community settings. And conflict resolutions, a part of staff skills, a low client to staff ratio. It requires continuous open communication among the staffs and client. It is more difficult in this therapeutic community. The role of nurses. So here the nurse is acting as a nurse manager in the therapeutic environment in 24 basis, 24/7. So they are the people who is responsible for the patients in a therapeutic environment. So they have the responsibility to ensure the client psychological and psychosocial needs, and whether it is met or not, that we have to be identified. And also having the responsibility of medication administration. One-to-one relationships must be developed, and setting a limit for unacceptable behavior and maladaptive behavior. Recognizing a positive behavior and client educations. So how can manipulate the environment? Manipulating environment with less stimulus as calm, quiet, sustainable. Keeping the environment. The nurse is being a nurse manager in the therapeutic environment as a 24/7 basis. And also nurse having the responsibility to ensure that the client psychological and psychosocial needs is met or not. Additional with that, we are having the responsibility of administrating medications, development of one-to-one relationships, setting limits on unacceptable behavior and maladaptive behavior, to recognize the positive behavior of the patients and promote that, and client education. And next, how we can manipulate the environment. So manipulating environment with less stimulus, with the calm and quiet, with the many patients, and we have to have a less free from all kind of a sharp instrument, and safe from high risk for suicidal patient. Prepares the environment with high provoking stimulus to be depressed patient. And next one is integrating about the therapeutic effect with the environment manipulation in the treatment purposes. These are the references which was adapted for the milieu therapy. Thank you.